Hispanics really account for a disproportionate share of diagnosis of HIV. Of this number diagnosed of HIV infection from 06 to 09, Hispanics accounted for 20% of the total, 17% of women, 18% of infections attributed to heterosexual contact, and 17% of children aged less than 13. So 19% of diagnosis of HIV infection among adults and adolescents were in Hispanic. It's a slide from CDC, and really the main points here are that it's pretty variable, the rate of diagnosis of HIV infection. It was 30.9 per 100,000 population in the 40 states with confidential name-based HIV infection reporting since at least January 2006. But we see the rates, from the Dakotas is 0. In places like, Louisiana, we're looking at 52.4. So very high, and of course high in places like New York and the Northeast. This next slide, again, is just the rates and the numbers and how Hispanics, adults and adolescents living with an HIV diagnosis is very high, is certainly much higher than whites and other races. In the Southeast particularly, to HIV and other STDs. One, of course, is age. It's a very young population that's migrating, roughly from their teens to their mid to late 30s. A number of them are unaccompanied. The duration of residence, especially if they're migrant or seasonal farm workers, it may be limited points of time, which may lead to perhaps, casual sexual relationships. Also, engaging in risky behaviors. Having worked with farm workers in labor camps, you do see cases with use of commercial sex workers, prostitution. Limited social support and housing, in a way, sort of go together because these create potentially risky environments for transmission, and issues with crowded housing, with addictive behaviors, and with a general lack of social support. And I think it's important to mention that the Southeast especially is may have as not being one of these sort of areas that were traditionally receiving states such as Florida, California, Texas, Illinois. There may not be as many social support networks in place, which definitely can impact some of the transmission issues we're talking about today. A few other items as far as susceptibility: substance abuse and needles. Injection drug use continues to be a risk factor for Hispanics, but also it's really uncertain, if transmission's taking place by lay injection of antibiotics and vitamins and the sharing of syringes. There's been some interesting research on that in Africa, but in the U.S., I think we're very much uncertain what the behaviors and practices that are going on. Also, as I mentioned, being a lot of these being conservative states with new policies and new immigration laws, that again just adds a layer of perhaps fear and feeling like they may not be able to access some of the services. Another point is sexual health and sexual health education. I work with a group of men in Shelby, Chilton County nearby, and I think it's apparent that a lot of these migrants don't have the level of education that we have as far as simple things like transmission of HIV. So it's important to consider that. And also disclosure of MSM or Hispanic Latino women may be unaware of their male's partner risk factors or incorrectly assess them. In 5 different studies of U.S. gay and bisexual men, Hispanics were reported to have the highest rates of unprotected male-to-male sexual contact. Some research that really, Tom Painter did a good job a few years ago in 2007 of really synthesizing a lot of what's been going on as far as the limited research and just some different areas of risk that may present themselves to this population. And, these are some of the points that he cited in his article connecting the dots. One is, AIDS case rates in general in the South are 18.2 per 100,000 compared to 14.7. And as I've mentioned with STDs, if you have higher rates in the population and you have a new group of folks arriving that could present risks. Also, prevalence among adults in Mexico is 0.3%, about half of what it is in the U.S. So migrants have a greater number of sexual partners and are more likely to use illegal intravenous drugs than non-migrants, some studies have shown. A few other points. Studies in North Carolina have shown 42% of men with extramarital sex partners, Hispanics 21% with 2 or more sex partners, 21% with 20 or more lifetime partners. As I said, migrants have a greater number of sexual partners and are more likely to use drugs, but also you have issues, as I mentioned before, like the Alabama syphilis outbreak, where all these men were Hispanic, and 20 of them had unprotected sex with a commercial sex worker. And so factors that contributed to that were crack cocaine use and increased prostitution in close proximity to a group of Hispanic males.